Hi, so I will be presenting the water-soluble vitamin Pyridoxal B6 for supplementation for nausea during pregnancy. So, to begin with, what is B6? It is one of the B vitamins. I will be covering what kind of vitamin it is, foods that contain B6, and its usage in treating and preventing nausea during pregnancy. So a few of the functions of the B vitamin B6, it is a water-soluble vitamin, and what makes it so important, it is used as a cofactor for many other processes within the body. So think about creating hemoglobin, amino acids, converting tryptophan to niacin. Also, it's really important for your immunity, transamination reactions, creating serotonin and dopamine. A lot of foods contain B6. However, we as humans lack the enzymes available to convert it to something that we can make without food. So for an overview of B6 metabolism, phosphate groups are removed during digestion. Alkaline phosphatase is used for phosphorylation. The absorption is very efficient. The liver is the primary organ for metabolism. And within the body, there are two other forms of pyridoxal B6 that are also used to be phosphorylated to PLP, which is the main form. So B6 is not what we use, it's not the active form of B6. And if we look at the next figure, you'll see pyridoxine, pyridoxal, and pyridoxamine. So let's focus on pyridoxamine. So you can see the hydroxyl group at the very top, right over here. So we need the pyridoxal kinase to phosphorylate this into this image right over here, pyridoxamine phosphate. Now that is accomplished by using ATP. And then pyridoxamine phosphate is converted to pyridoxal 5-phosphate, which is over here, and it uses oxygen to be oxidized right over here. And you'll see this group over here, a alcohol group. These are other forms too, from pyridoxine and pyridoxal. I have a link at the bottom if you would like to have this image directly. Now, for some foods that contain B6, so mostly starchy vegetables, so potatoes, pork, poultry, fish, pistachios, many nuts, bananas, fish are really great options for B6. So B6 used during pregnancy. So used for preventing nausea, about 25 to 50 milligrams per day. And studies show it can help with vomiting as well. B6 is found to be naturally low during pregnancy. So a lot of the studies I was reviewing showed that the fetus actually seems to be absorbing the B6 from the mother within the body. And other studies show correlation between severe nausea and low B6 levels. So what really inspired me to research this vitamin is I noticed that many of my clients that I see for nutrition counseling, I'd look at their medical records or documentation or medicines they were taking, and many of them were being prescribed high dosages of B6 or type of medication that had B6. And so upon seeing that, I was really interested in the use of that. Before that, I had always thought Zofran and promethazine were what was mainly used for that. So B6 and nausea during pregnancy. So usually between 20 to 50 milligrams of B6 can be used to treat nausea during pregnancy. A lot of the studies were shown that B6 was more effective when combined with other materials such as ginger, an antiemetic, antihistamine, or doxylamine. And it is hypothesized that B6 can help alleviate nausea due to its precursors to forming heme for your iron, amino acids, and other neurotransmitters within the body. And I found it very interesting that these studies have been going on since the 50s and 60s, and it was actually very heavily used, but the mechanism behind it isn't still fully understood how it works to help relieve nausea. So this study here was done, the comparison of ginger with vitamin B6 in relieving nausea and vomiting. This is a randomized, double-blind clinical trial, and the women who had nausea and vomiting did not take any medications in the study. So the study was comparing the effectiveness, and it did show that ginger is just as effective as B6 with alleviating nausea. However, it showed that when you combined ginger and B6, that was the most effective in alleviating nausea. And many other studies, which I provide in my reference slide, also show that ginger itself is very effective, about 1 milligram a day of ginger, which is great because it's definitely affordable, and ginger is anti-inflammatory, which helps, many other processes within the body. The next one was the association between B6 and doxycycline. So doxycycline with B6 is approved by the FDA in the United States as the brand name Diclectin. So this has been approved before use in Canada for many years. And most studies do show that B6 combined with doxylamine is more effective than B6 alone, or even B6 with ginger. And this study was done by Hassan and Dubai. And one of the things that they did mention about this study is that some higher levels of the medication were associated with more adverse effects, such as headaches. So I thought it was important to note that it's probably a better use to, if you can, do more of a natural alternative method. So right here, the DRI recommendations. RDA is 1 to 1.3 milligrams a day for adults. Deficiencies are so rare with B6 because it's found in so many foods, and it is a water-soluble vitamin. Vitamin B6 deficiency. It can result in convulsions, depressed symptoms, neuritis, poor growth, decreased antibody formation, weakness, irritability, insomnia, and dermatitis. Toxic symptoms include irreversible nerve damage and numbness. Let me go over here. So, DRI recommendations during pregnancy. The recommended dietary allowance for vitamin B6 in pregnancy is 1.9 milligrams a day, which you'll notice is a lot lower than what you would use for severe nausea. Most of the studies do show that the more severe the nausea, the higher the dosage of B6 would be recommended. So I think for women who have a lower dose or lower severity of nausea, using a lower dose, or even just a prenatal that has the required amount of B6, and then starting off with other methods to help with nausea would be more of my recommendation. Implications to practice. Around 80% of women experience nausea and vomiting during pregnancy. So I actually have many clients who complain to me about the severity of their nausea, constant vomiting, and severe nausea or hyperemesis can cause significant weight loss during pregnancy, especially during that first trimester. A lot of my weight checks that I do, I'll see 5% or more weight loss. And I usually go over ways of, preventing nausea by not eating spicy foods and eating, smaller meals throughout the day more frequently, crackers, starchy foods to help with the nausea. B6 is naturally occurring in many foods, as I mentioned before. So I think a registered dietitian can counsel a patient with ways to decrease nausea by just at first increasing B6 rich foods in the diet, using ginger, taking the prenatals every day, doing that method before going to maybe higher medications such as Zofran or promethazine, which does require a prescription. And this next slide here treatments for nausea and vomiting during pregnancy. So here I really like this diagram because it does show the dietary changes, which is what I usually focus on. It's just, avoiding spicy foods, foods that are with strong odors or flavors, eating more frequently. I always recommend carrying a little snack in your bag for when you go out. Prescription medications, so the vitamin B and doxamine. Antihistamines were also shown to be more effective when combined with B6. Over-the-counter medications, acupuncture, vitamin B6, and ginger. And then for conclusions, so supplementation with vitamin B6 during pregnancy may reduce symptoms of nausea and vomiting. More studies are needed to understand the mechanism of how B6 helps to alleviate nausea. Natural treatment should be advocated before using pharmacological methods, and B6 is more effective when combined with ginger. And then over here, these are the questions that were part of the project. So over here, I go a little bit more into how B6 is metabolized. All three forms are necessary to get in the diet because we do lack the ability to synthesize the precursors. And for the DRI, it is the 1 to 1.3 milligrams per day. In concluding this presentation, I would like to mention that with the nausea and vomiting, I really think it's important to do a 24-hour food recall just to see what the patient is eating and if they are getting enough B6 before going straight to giving them any kind of supplement. Also, not prescribing anything, just saying these are some foods that may help. Asking them if they're taking their prenatal, see what kind of prenatal they're taking to see what the dosage of the B6 vitamins are in there. And also, supplementation is really important. It can help with reducing maternal anemia, reducing the incidence of some congenital abnormalities. Supplementation obviously can help with preventing and treating nausea and vomiting. I did find one study that did say it was more effective to use it as a preventative measure. One thing I would like to note that nausea and vomiting during pregnancy aren't necessarily bad for the baby. In fact, there are some studies that show that experiencing some nausea and vomiting was associated with, better pregnancy outcomes. There was a link between the hormones and vitamin B6 as far as, the metabolisms, since B6 is used for so many other things. Was hypothesized that perhaps with the pregnancy and the fetus absorbing, the calcium and iron and the B vitamins, it kind of leaves the body having to work a little bit harder to synthesize more of these cofactors, which can be a cause for that. There's also the psychosomatic component of the studies, as far as some women had the belief that because they were pregnant, they would automatically have to experience nausea and vomiting. So it was a lot of factors when trying to treat this. However, I do think that suggesting foods high in B6, also, endorsing taking a prenatal daily is really important with that. And the main pathways over here, let me go back to this diagram here. So we can see here, these three use the same kinase in order to be phosphorylated to the active form of the vitamin B6, which is the pyridoxal 5-phosphate PLP. So all these processes occur within the liver. So with that said, there are studies that show that alcohol intake can disrupt this. So perhaps moms who have problems with, still drinking alcohol, like letting them know that this is definitely, or it could be, you can test the level of B6 within the body by checking the PLP levels in the body, and if they're drinking or certain disorders where they're not able to metabolize B6 well, that can affect it as well. Well, thank you so much for listening to my presentation. Have a wonderful day. Thank you.